Hey everyone, this is Grace the Nurse, and I am going to play one of my favorite medical games called Full Code Medical Simulation. So, this is a great game if you're a nursing student, medical student, nurse, provider, and you just want to practice your skills without killing someone. This is fantastic. So, today, what I'm going to do is difficulty breathing and kidney failure, case number 14. So 85-year-old female, 2 days of increasing shortness of breath, found at home hypoxic, 89% room air, no chest pain, cough, or fever. Missed dialysis 2 days ago. Here is our little lady. The way this game is set up, there's your patient, the attending physician. You can always click her and ask her for any help. Nurse, she can also help you out too. So I always tell my students, when you're coming into a situation, you don't really know what's going on. One of the first things you always want to do is vital signs and assessment. So for vital signs, you're going to get her on the monitor. Oh, well, that's not good. So she's hypertensive, desatting 86% on room air, not good. Tachypnic 22. So I'm going to put in an IV anyway, just because with these vital signs, she's going to need some sort of possible emergent medication. Also, because she is desatting, we're going to put her on nasal cannula oxygen. So when it comes to a patient that you don't know their medical history, you don't want to give them more than 2 liters of O2 just because you don't know if they have a history of COPD. So COPD patients, you don't want to go above 2 liters of O2 because that can actually put them into respiratory distress. So until we figure out her past medical history, we're going to keep her on nasal cannula just for now. So let's talk to our little lady, Anna Desjardins, 85 years old, full code. She's so cute. Okay. Thank you for seeing me today. Why, thank you for coming in. So, how are you feeling? I'm feeling really short of breath and weak. Okay. How long have you felt this way? I'm feeling this way for the past 2 days. Okay. So the reason why I'm saying how come instead of why, one of the things that I've learned that is if you ask someone why, it's almost confrontational. So if you can avoid saying why, patients and people, they won't take it as confrontational and may be a bit more receptive. So I missed dialysis because my ride didn't show up to take me. What? Yo, where's your ride? I'm gonna find them. I'm gonna tell them you bad. Oh, poor little lady. Okay, so thank you for sharing that, Miss Anna. Do you have any trouble laying down flat? The reason why I'm asking that, because she missed dialysis, I'm very concerned about fluid overload, and that is one of the signs of fluid overload. Patients, they can't lay flat, so that means there's most likely fluid in her lungs. So in my mind, I'm already thinking possible pulmonary edema. Okay. Do you have any chest pain? Okay, good. Do you have any allergies? I'm not sure if I have any allergies. Oh, lady. Okay. We're gonna assume none, hopefully. Hopefully she doesn't have any. Okay, end-stage renal disease, high blood pressure, diabetes type 2, obesity, IBS, back pain. Okay. Are you taking any medications? For the blood pressure, metoprolol, amlodipine, Lasix, diabetes type 2, the metformin, glipizide, and insulin. Hyoscyamine is for the IBS, and lidocaine patch for the back pain. So she has taken all of her meds. So we are now going to assess her. So moderate respiratory distress, GCS 15. So because she did not mention COPD, I actually want to put her on more oxygen. So we're going to put her on a non-rebreather mask because that O2 sat was unacceptable. We're definitely not doing fluids. No, she has signs of fluid overload. So let's assess our little lady here. So another thing I always tell my students, whenever it comes to priority, always think ABC, safety. Airway, breathing, circulation. So I love the fact that this game, that's what they start out with. So luckily, ABC looks good. Heat is good. Ooh, neck, positive JVD. So JVD is jugular vein distension. So that is the jugular vein. The jugular vein is distended. That's another sign of fluid overload. So no good. Luckily, cardiac looks good. Pulmonary, bilateral rails. Rails are crackles, so another sign of fluid overload. Oh, look at that, huh? Hepatojugular reflux. That is also a sign of fluid overload. Musculoskeletal. Oh, look at that. Pitting edema to the mid-calves. So, yet another sign of fluid overload. I want to get an EKG. I definitely want to get a blood sugar because she is a diabetic. And because she is complaining of shortness of breath and she has rails, lower extremity edema, we're going to get a... So this is an echocardiogram, ultrasound cardiac. Because she has lower extremity pitting edema, I just want to get lower extremity venous ultrasound to rule out DVT. So when you have a patient that's in distress, the most common labs ordered on patients in distress are always EBG, especially because she's desatting on room air, Chem 7, coagulation panel, just want to rule out any bleeding, and CBC. So those are always the 4 most common labs ordered on any patient that's in distress. And then the rest of them, definitely it's based on the presentation. I'm also going to get a lactate. So this is basically how you can tell if there's any hypoperfusion of the organs. We're going to get some LFTs just because she had some hepatojugular reflux. I'm going to get a mag-phos because she did miss dialysis 2 days ago, so those might be elevated. Pro-BNP, that is a way to tell if someone is having CHF. Troponin, we want to rule out MI, UA. So she's a dialysis patient. Why not? Let's see if she can provide any urine. I want to get a CRP and also a SED rate. So these are a way to tell if there's any inflammation. We do not need a serum HCG. She is 85 years old. I highly doubt she's pregnant. So that's what HCG is about. That is the hormone to tell whether or not someone is pregnant. I definitely want to get a chest x-ray. See, this hospital's awesome. I wish I worked in a hospital like this where you send things down and everything is done in 1 second. That is the best hospital ever. Let us look at the x-ray first. Okay, so absolutely it's showing pulmonary edema, no good. So SED rate, CRP are normal, excellent. Troponin, negative. And if you're unsure of the range, you can always click the eye, it can tell you the range. BNP, not surprised. BNP is a way to tell if someone is having CHF type issues, and that is extremely elevated. Whoa, look at her potassium. No good. Very, very high. BUN creat, this is actually expected because she is an end-stage renal disease. Yeah, and O2, that's not good. So the oxygen level is low. Thankfully, for lower extremity venous ultrasound, negative for DVT. Looks like her echocardiogram is normal, blood sugar is normal. Her EKG is concerning. As you can see here, the T waves are quite peaked. So that is consistent with hyperkalemia. Because she has peaked T waves and she's end-stage renal disease and she missed her dialysis 2 days ago, she really needs stat dialysis. I want to communicate with renal. I can arrange emergent hemodialysis for this patient in ICU. Yeah. Also, because she is short of breath, I'm just going to consult pulmonary anyway. Pulmonologist not sure why you call. I love when they say that. I don't know why you called me. Well, bro. Short of breath. Okay. Concern about respirator status. I did that. All right. So we are going to send her to ICU because she just really needs dialysis stat. So for differential, you have to diagnose them. So the first one, absolutely hyperkalemia. Because her BNP is elevated, it looks like she is having a cardiac-related pulmonary edema. So I'm going to click on acute pulmonary edema. And let's send her off to ICU. So handoff, ICU. Gonna click the diagnoses. Nurse is like, are you sure? Why, yes, fellow nurse. Thank you for double checking. Let's see. All right. Better. I wish it was 100, but 79.8, I'll take that. So I was correct with the diagnoses, my disposition. It looks intervention 0. What? Okay, I gotta see why I got a 0. So critical 0 of 5. What did I miss? I think I got a lot of good stuff. I'm not gonna click that because I don't like cheating. But, what the heck? You guys are watching my video. Let's see what the answers are. So the reason why I don't want to do an antihypertensive agent, she needs dialysis. So when a patient like that is fluid overloaded, usually with dialysis, their blood pressure will come down. Although I do see what they're talking about. Oh, that's interesting. Huh. Okay. I did not realize that. So albuterol, I guess, can lower potassium. I didn't know that. Calcium chloride bolus. So D50 with insulin is a way to get the potassium down. Okay, that's true. And that one I'm not too sure of, just because her blood sugar was normal. But so basically, when you're giving D50 and you give the insulin, what's going to happen is not only will the insulin push the sugar back into cells, it actually pulls in potassium. So that is another way to lower potassium. So when I was an ICU nurse and someone was on an insulin drip, I always made sure to keep an eye on their potassium level, because they were actually increased risk of hypokalemia. And then furosemide bulk. Are you kidding? No. Well, all right. What else? She still makes some urine, but in my experience, these types of patients, they just need stat dialysis, and usually that cures the hypertension, the fluid overload, But okay, I see. All right, well, I hope you enjoyed watching me play 79.8. I think that's pretty good. I think that's good. So if you like this game, you can actually download it for free on Apple Store, Google Play, or you can go to their website, fullcodemedical.com, and play it in their browser for free. Thank you so much for watching. Check back soon to watch me play this again. Oh yeah, this is like my Fortnite. So I get very excited when I play this game. All right, thank you. Bye.